is 10 years of No Shave November at Penn State Health. Wow, and this year's campaign didn't just grow beards, it exceeded expectations. Joining us now are Dr. Jay Rahman, Chair of the Department of Urology at Penn State Health, and Rory Retrieve, President and CEO of Mid-Penn Bank. And they're here with big news and an even bigger fundraising reveal. Gentlemen, welcome to the show.
Thank you.
Good to see you. Dr. Rahman, when you look back at a decade of growth, awareness, and community impact, what stands out most to you?
Well, I think it's really just the growth. You know, the first year, I think Mid-Penn Bank raised some money during No Shave November, donated to Penn State Health Urology. Second year, we partnered up together, and now it's grown. You know, more individuals, more businesses, more community partners, more people just getting the message out.
Yeah, and that's a good thing. And Rory, we've talked about this over the years too. You've been here doing it, but let's reveal the total amount you all raised together this year and talk about what it means to hit such an incredible number during this anniversary.
So back at our kickoff party in late October, Dr. Rahman stood up and I asked him what he thought the goal should be, and he said $350,000, which I thought was a really big number.
Yeah.
But as it turns out, he was like Babe
Pretty
Ruth
close.
in Game 3 of the 1932 World Series, because we ended up raising
Here it is.
$355,000.
Wow.
Wow, look at that.
What a fabulous month.
It even went over that
Yeah,
guess, but that
just
was
a
pretty
little
close.
bit that was
good.
a great shot to call.
Can you share how this year's funds are going to be used, Dr. Rahman, especially for research and education?
Yeah. I always say the funds we use, it's really 4 pillars. You know, research, particularly prostate cancer, prostate diseases, screenings, not just at Penn State Health, but this year we're going with the mobile Lion Clinic to hopefully go to more rural areas. Survivorship, you know, building a survivorship network for patients so they have a community. And the last is really education, letting students, trainees go out, do research, present their work, and hopefully continue this, you know, long after Rory and I have sort of retired.
Yeah, but this is going to help. I mean, what a big number. And certainly, Rory, let's talk about your community partners and the first ever Dash for the Stash. How did this event help the campaign this year?
Yeah, so the community partners, we had 20 community partners this year, all throughout Pennsylvania, even in New Jersey. You know, 5 of them really stood out: Craft Concepts Group and Steel Penny and my alma mater, Bishop McDevitt, the Tower Porter Improvement Organization, and our friend Al Comiskey of Al's of Hamden, Pizza Boy Brewing. So they all chipped in a lot. And then we had our Dash for the Stash a couple weeks ago on a Saturday. And I think it was a big part of the overall awareness and getting more people into No Shave November. So it was something that we've talked about for years.
Many years, yeah.
And that we were standing there on you know, a couple Saturdays ago. It was kind of surreal.
Yeah,
and
that was great.
I think it was a big part of the fun this year.
It's a good thing, and the hope is it keeps getting bigger. So, Dr. Rahman, what's on the horizon for Penn State Health Urology in 2026?
Yeah, I like to think innovation. So, and I think that's not just true about Penn State Health Urology. I think it's Penn State Health in general, just being an academic medical center. So the example I'll give you is we've been doing focal therapy for prostate cancer called HIFU since 2023. And the question is, how can we do it better? And so in 2026, for example, we now have a brand new robotic HIFU system. So same HIFU technology, but now using robotics and computer interface to really improve on the therapy. And I think that's sort of the theme is, what are we doing? And then how can we do it better?
And yeah, so stay tuned, in other words, right?
Absolutely.
There's always a friendly rivalry between you two, okay? Rory, how does the collaboration between Mid-Penn Bank and Penn State Health push both teams to kind of raise the bar overall for men's health in general?
Yeah, I think you start with 2 really great organizations, Penn State Health and Mid-Penn Bank, and then, you know, Dr. Rahman is fortunately the head of the urology group at Penn State Health, and I have the pleasure of being the head of Mid-Penn Bank, and we built up a really good relationship over these 10 years, and I think that it permeates through the entire campaign. You know, we root for each other. We try to compete with each other. He did kick my butt this year. He was our top fundraiser, which is amazing. The amount that he raised on his own is 15 times more than what we raised the first year when we first did the campaign. So, amazing thing.
It really is.
Great year.
Really
well, we appreciate both of your hard work in the community. This is going to go a long way to continue this trend, and we hope to see you again next year with even more success stories. So thanks for coming on.
Yeah, thank you. And thank
Absolutely.
you, as always. Appreciate it.
That's awesome.